Alright, so how are we doing today? Time for our final video today, so I hope you're doing well. Alright, so I'm going to try to do an economic theory video here and there from Reason.com. I have to do economic story every now and a while because I'm currently studying economic theory. I've gotten a pretty good understanding of it, so I need to put my commentary to stories relating to it, or it's just a waste of time. This is under Medicare for All. Bernie Sanders thinks Medicare for All could cost, get this, $40 trillion. The cost of single payer would dwarf the price of Obamacare. When thinking about the cost of healthcare legislation, it's helpful to put the numbers in context. The final cost estimates for Obamacare, which passed in 2010, came in around $940 billion over a decade, and the legislation was structured in a way designed to move some spending outside the 10-year budget window in order to keep the cost under $1 trillion, which was generally considered the threshold of political acceptability even amongst Democrats. A trillion healthcare plan was just too expensive. Former Vice President Joe Biden's recently announced plan to expand Obamacare comes in around $750 billion over a decade, which at more than 3/4 the cost of the initial legislation makes for a relatively pricey fix. Yeah, no kidding. Our military budget's in that range as well. How do they think they're going to get away with all this spending? I mean, this government is not maintaining a balanced budget. We're debt spending still in certain sectors. And this is largely the reason why our infrastructure is crumbling. We're spending so much money on military and on the welfare state that we have nothing left to support essential power structures and proper civics. We don't have a high-speed rail. Japan has a high-speed rail. China has a high-speed rail. Many other big, powerful nations have a high-speed rail. We don't have a high-speed rail. We just have regular-ass trains. We have Amtrak. I mean, that's just one example. How about the fact that our nation's power grid is not stable? Many of the electrical components are old and out of date and need to be replaced. But no, we can't afford it because we're spending all this money on the welfare state and on the military. Go figure. You spend too much money in one place, you don't have any for another place. Go figure, right? Simple math. In contrast, estimates from organizations across the ideological spectrum have pegged Bernie Sanders' single-payer healthcare plan, Medicare for All, at around $32 trillion over 10 years. The vast gap between the cost estimates reveals the dramatic difference in scale between the Obama-Biden healthcare plans and Sanders-style single-payer, and suggests how radical and expensive Democratic healthcare policy has become over the last decade. And Sanders appears to think the cost could be even higher than those estimates of a Washington Post forum, he said. That he expects his plan would cost somewhere between 30 and 40 trillion. And then he defended the price tag on the grounds that it would actually be cheaper than the alternative, letting today's system or something roughly like it continue. Citation needed, Bernie? Somewhere between 30 and 40 trillion over a 10-year period, Sanders told the Post's Robert Costa. What the most serious economists tell us, that if we do nothing to fundamentally change the healthcare system, which is what Joe Biden was talking about, keeping it as it is, we'll be spending something like 50 trillion over a 10-year period. Oh, so your plan's going to cost us 10 trillion less. Cool! No, seriously. How about stop worrying so much about healthcare? Because that's our problem. That's not the government's problem. That's our problem. We, the people who are getting sick, that's our problem, and we should be contacting our doctors, setting up our own healthcare plans by buying packages from companies that sell it. And you should be worrying more about fixing the pothole-filled roads that you make the taxpayers pay for, or the crumbling infrastructure in general. Bridges in serious disrepair, buildings having to be condemned, a power grid that certain portions of it could fail us at any time. How about that? Why don't you fix that, Mr. Sanders? Single-payer supporters often make the argument that their plan, which would eliminate virtually all private insurance and rely on the government to finance the vast majority of healthcare services in the country, would cost less than maintaining the current mixed public-private system. There are several things worth keeping in mind about that claim. The first is that what they mean when they say single-payer would cost less is that total healthcare spending would be less overall. The cost of the government would be far, far higher than it is today, as all of the spending that now flows through private payers would move onto the government's books. And it's not all clear that single payer would actually result in reduced overall spending. The studies that have attempted to estimate the cost of Sanders' plan have typically accepted it at face value, the assumption built into his proposal that the new system would maintain today's Medicare rates for healthcare services. Those rates are in many cases substantially less than what private insurance pays. One estimate concluded that providers would face cuts up to 40%. Paying those rates everywhere would almost certainly cause substantial disruption to the provision of healthcare, especially at first. Some hospitals, especially facilities that serve the rural poor, would almost certainly shut down or drastically reduce their services. Which is why it is plausible, perhaps even likely, that those rates would not be sustained over time. And if Medicare's pay rates were increased, that would eat into our estimate the supposed savings. Indeed, in Maryland, the one state to pay equalized rates for all hospital services, Medicare pays for far more than it typically does elsewhere. Bottom line is, with this amount of government regulation, that's why private healthcare is so expensive. And not only that, but when you're reliant on the state for everything, for income, for wealth, for food, for healthcare, you become a child of the state. You have no sense of self-reliance. And the reason why the Scandinavian countries have succeeded is not because of their welfare state, as AOC would claim, but rather it is because their culture for a long time emphasized self-reliance, a sense of responsibility, and working for everything you have. And that work is what ultimately built up their country. Do you really want to live in a country where you have no sense of duty, responsibility, or self-reliance, that you become a child of the state, that all your money gets redistributed, and the redistributionism kills your GDP, sometimes lowering it to as much as 10% on the global scale, or even 0%, like Sweden in the 1970s? Or do you want to actually work and pay for private healthcare and have self-reliance? Because to me, that sounds far better. Plus, this crazy spending, Bernie Sanders would spend this country into oblivion. I am absolutely convinced. On his healthcare alone, given all the other expenditures we're making, Trump's wall, well, part of it was already built, the military budget, defense from whatever the hell they come up with next. We can't afford this. Our infrastructure is not receiving enough money as it is. Our infrastructure is falling apart. And yet we're spending all this money on military and everything else, and now he wants to spend even more on healthcare. Bernie Sanders is a fucking idiot. Sanders, meanwhile, has already demonstrated he's willing to spend more to keep hospitals afloat. He's complained about potential hospital closures he fears would reduce access for the poor, and yesterday he proposed a $20 billion bailout fund for struggling hospitals, many of which have a patient population that is heavily reliant on government payers, like Medicare and Medicaid. Sanders wants to use government money to bail out hospitals that are struggling because they rely too heavily on government money. Sanders can't have it both ways. He is either advocating for a plan that would result in a dramatic curtailment of healthcare services, especially for the rural poor, or for a system that costs far more than the sky-high price tag to which he has now admitted. Now, let me tell you a bit of an anecdote that was shared by Ron Paul, an actual doctor, who said unequivocally that government-paid health care has killed the doctor-patient relationship. And as someone who knows the esoteric origins of the modern medicine from the old occult practice of pharmakia, a pharmakia was a healer who wore white robes, right? It's all about mindset. If you want to heal someone, you got to be in the right mindset. The desire to heal must exist. The white robes, the color white, associated with all manner of good intention. You know, white was a good color, black was a bad color. And to some extent, that's still in our culture somewhat. And so, you know, that robe sort of put the wearer in the mindset of, I'm going to heal this person. I'm white. I'm helping. And that is why doctors wear white lab coats. That is the origin of the doctor-patient relationship. The desire on the doctor's part to heal, and the patient's desire to be healed, creating this sort of empathetic connection. And that is sort of my observation added on top of Dr. Paul's mention of that. And that was just a bit of a side note that I felt deserved some attention. But also, it is true that he wants to bail out hospitals that are already overly reliant on government assistance. Government assistance created the problem in the first place. These hospitals are struggling because they don't make enough money on their own, because they're already subsidized. Do you understand the problem? Like the article said, Sanders wants to use government money to bail out hospitals that are already struggling because they rely too heavily on government money. They're failing because they have not found a way to self-sustainability on their own yet. That is the problem, my friend. That's your issue right there. They're already too reliant on government money, and your solution is to pay them more government money. It's not even government money, it's taxpayer money, it's our money. Taxation is theft. Plain and simple. I mean, look at the definition of theft and then compare it to the definition of taxation. Taxation fits into the definition of theft. No ifs, ands, or buts about it. Bernie is a thief who doesn't know how to spend money. He doesn't understand economics. He's never worked a 9-to-5 in his life. He's lived off welfare his entire life. He's your classic ivory tower liberal who's like, I understand the struggle of the working class. You have no idea. It's like, exactly, you have no idea. You don't understand the working class. You don't understand anything about us. You're some curmudgeonly old sycophant who thinks he knows more than he really does. Who in their right mind is going to vote for that? I won't. Anyway, rant time over. See you, folks.